Welcome to On the Beat, everyone. I'm Troy Thompson. Joining me today is Dr. Ricky Johnston and Dr. William Gillespie of Gastroenterology Associates of Columbus. Today we're talking all about small intestinal bacteria overgrowth. That's a mouthful. Welcome to the show, both of you.
Thank you. Appreciate it.
Do I have it? What is it?
Yeah.
You know I like to self-diagnose.
You do that. By the way, SIBO for short.
SIBO?
So that's how we condense things in the medical field. We take these long terms and make them easier on the tongue.
Thank you.
Yeah. Well, SIBO, or intestinal bacterial overgrowth, is actually what it sounds like. You get overgrowth. Or so back up. Our intestinal tract has tons of bacteria in it. We have more bacteria in our guts than we have cells in the rest of our body.
Are you serious?
We have, tons of bacteria. So bacteria are very important.
Can I just say this? I'm jumping off. When you say bacteria, that scares people, but there's good bacteria and bad bacteria, right?
Right. Well, most of the bacteria in our gut are good bacteria.
Okay.
We would not be able to live without them. They help us process the foods that we eat and, with digestion and, gives us, that's the reason we have gas too, because of the bacteria fermenting the foods in our intestine. So you've got good bacteria, yes, but SIBO is when you get an overgrowth of too many of the bad bacteria.
Right.
And that can lead to some problems.
Okay, well, let's talk about the problems if we can, Doctor. What are they? How do I know I have it?
Well, the symptoms that you would have, a lot of people can get a lot of diarrhea, gas, cramping, kind of sour stomach, and it's kind of a non-specific symptoms that you would have.
Right.
The way that we would usually diagnose it is either doing a breath test,
really?
or sometimes we'll just treat with antibiotics and see if that helps.
So is this again caused by diet?
That probably has some contribution to it. We tend to eat foods that are more food, I guess, for the bacteria, are more likely to make them grow. So that can certainly be one of the causes is diet. Some of the other things, people who've had intestinal surgery, when you reroute, the intestines because of a prior resection for something, that might promote growth of the bad bacteria. And there's certain conditions that might promote this as well. Diabetes, diabetics kind of get a general slowing of their GI tract, and some of that stasis that you get from things not moving through as quickly can cause overgrowth of the bacteria.
Okay, so we may be bloated, we may be having gas, we may be feeling any heartburn or anything like that?
Not necessarily heartburn,
okay.
but certainly kind of the
You feel
sour,
uncomfortable, you know something's going on.
Yeah.
When you said treatment, you said antibiotics, right? If we have the antibiotics and it's not working, what are the next steps? Are we needing operations? Are we removing anything?
Not usually. We'll usually just try again if we have a confirmed diagnosis. Sometimes, we'll try a different antibiotic.
Really?
One of the antibiotics we use for this condition can be very, very, very expensive. So sometimes we have to.
Covered by insurance.
Yeah, and insurance does not like to pay for it. So sometimes we have to try a few different things before we can, get relief of the symptoms.
And when we're diagnosing it, how are we diagnosing it?
Well, either by doing a breath test,
Or the stool, I think you said.
Or if somebody has all of the symptoms in a predisposing condition, we sometimes will just go on ahead and treat.
People come in and tell us they have a lot of noise in their abdomen, noisy kind of
growling.
Yeah, growling.
Yeah.
And sometimes that can be an indicator.
I'm getting that about now because I'm hungry.
Yeah. Well, some people will actually have significant visible swelling and distension of their abdomen. They'll come in and be like, I look normal now, but later on I'll look like I'm 9 months pregnant. So the abdomen can actually visibly swell out.
I was just saying, I'm going to go off topic again. I was talking to someone the other day, talking about our body and the signs it gives us that something is wrong. Don't you just find it fascinating, being a doctor, that you know what the body's telling you is wrong with your patient?
It's pretty fascinating.
Yeah,
it's not always so simple.
I know, but I'm just dumbing it down. Let me have that. We appreciate both of you coming in. Thank you so much. If you want to find out more information, there it all is up on the screen. Been chatting away with Dr. Ricky Johnston and Dr. William Gillespie of Gastroenterology Associates of Columbus. Back after this short break.